Epidemiology of viral diseases. Commonly used terms: incidence rate, attack rate, a measure of the occurrence of disease in a population over time, month or a year. It's used for describing acute disease of a short duration. Incidence rate, number of cases multiplied by 10 divided by the prevalence rate, variation at a particular point in time of number of cases currently present in the population divided by the number of animals in the population. Incidence rate, number of cases multiplied by 10 divided by population at risk at a particular point of time. The prevalence rate is thus a function of both the incidence rate and the duration of the disease, commonly termed morbidity rate. The percentage of animal or human in population that develop disease due to virus over a defined period of time. Mortality rate, the number of deaths from the disease in a given year divided by the total population at mid-year cause-specific mortality rate. Other terms and concepts used in epidemiology: endemic disease, the continuous occurrence of disease in a population over a period of time. Endemic disease, the continuous occurrence of the disease in a population over a period of time. Epidemic disease refers to peaks in disease incidence. Pandemic disease refers to worldwide epidemics. Example: 1918 influenza pandemic. Epidemic disease refers to peak in disease incidence that exceed the endemic baseline. Clinical severity, potential economic impact. Phylogenetic Newcastle disease virus in poultry flock, or coronavirus in the human being in the recent days. Virus transmission cycle require entry into the body of a susceptible host, replication in its cells, shedding, spread to another host. Transmission cycle: entry, replication, shedding, spread to another host. Virus transmission may be horizontal between animals within the population at risk, or between humans within the population at risk. Vertical from dam to offspring, or from the mother to its daughter. And intertransmission. The transmission may occur direct transmission, licking, rubbing, biting, sexual contact. Indirect transmission: eating and drinking, containers, bedding, vehicles, syringe and needle, clothing, common vehicle. Fecal contamination of feed and water supplies, airborne via droplet, foot and mouth disease. Horizontal transmission: by arthropod transmission, iatrogenic transmission, multiple use of sealing, non-sterile equipment, contaminated vaccine. Arthropod transmission by bites of mosquito, as Rift Valley fever, West Nile virus, Congo blue tongue virus. Nosocomial transmission occur in veterinary hospital. Disinfectant may be effective as in CBV. Zoonotic: from animals to man, Rift Valley fever, West Nile virus. Arthropod vector: mosquitoes, Japanese encephalitis, dengue virus, yellow fever, Stewart-Lee's encephalitis, equine encephalitis, Western equine encephalitis, Venezuela wild encephalitis, Rift Valley fever, ticks, Chromium Congo hemorrhagic fever, various tick-borne encephalitis, sandy flies, Cilician sandy fly fever, Rift Valley fever. Viral zoonosis: non-arthropod borne, herpes viridae, B virus, monkey, mode of transmission by animal bites. Here the virus family, here the virus, here the reservoir, and this is the mode of transmission. herpes virus, B virus, monkey, the animal bite, mode of transmission, pox virus, virus, the virus, the reservoir sheep and goat, mode of transmission skin abrasion, rhabdoviridis, rabies virus, Brets, skin abrasion, filoviridis, Ebola virus, monkey, bats, reservoir, rodents, iatrogenic nosocomial, morbidivirus, monkey, bats, rodents, iatrogenic nosocomial, orthobizoviridis, influenza virus, swine birds, respiratory, boniaviridis, Handan virus, rodents, contact with rodents and urine, arena virus, Lassa virus, rodents, and mode of the animal bite here, the mode of transmission, contact with rodent urine. Arthropod virus genus, flavivirus, HV, rodents, that is the reservoir is the rodents, arthropod vector is the ticks, flavivirus, Rift Valley fever, mammals, the reservoirs, the mammals, and also vector mosquitoes, boniaviridis, the mammals and the ticks, boniaviridis, Caliph encephalitis, mammals, the reservoirs, and the vector mosquitoes, Codivirus, Riovirus, Colorado tick fever, the reservoir is the mammals and the vector is the tick. Arthropod-borne virus transmission pattern, over 500 arbovirus are known, about 40 causes disease in domestic animals, some of which cause zoonotic diseases in man. Arthropod transmission may be mechanical, the virus restricted to the mouse part of the vector. Biological, the virus replicates in the tissue of the arthropod vector. In mosquitoes, the virus ingested with blood meal, sufficient amount of the virus must be ingested, not less than 10 raised to 5 power 5 infectious units per ml. Virus multiplies in the gut epithelial cells. The virus leaks from the gut and infects the salivary glands, and the virus releases in the saliva during feeding. Cycle of Rift Valley fever infection. Here we find the mosquitoes, the vector, handling season, amplification, okay, and the valley fever cycle involving mosquito, animal, and the direct transmission to human. West Nile virus transmission cycle. West Nile bird as a reservoir host, and the incidental infection occur in the animal, and the incidental infections occur in human. Rift Valley fever emergency factor. Summary of Rift Valley fever emergency factor described and analyzed by Wilson. The economic development, the example or relative to Rift Valley fever, dams and irrigation, improvement, human demography and behavior, living with domestic animals, slaughter of sick animals, vaccination of healthy animals, international travel and commerce, domestic ungulate, export, human travel and migration, biological adaptation and change, increased viral virulence, improved vector competence, greater animal susceptibility, climate events, excessive rainfall. Vertical transmission, infections transferred from them to offspring before birth, avian leukosis virus, approved virus, bovine viral diarrhea, IVR. These infections may lead to immune tolerance, persistent viremia, early embryonic death or abortion, congenital defect, congenital diseases. Here, bovine viral diarrhea as example of the vertical transmission. Here, subclinical, here clinical, mild, severe, death occur, and abortion of the calf, persistently infected, immunotolerant, mucosal disease, occur in 40 to 120 days. Here abortion occur in 90 to 160 days. Abortion or abnormalities, the antibody is positive or negative. More than 160 days, birth of abortion occur, or normal cause, antibody and immunity. Less than 40 days, embryonic is early